birth control and acne is an important subject to think about. We know that testosterone receptors, enzymes that convert and make testosterone active in the tissue is critical, and we know that certain birth control pills are helpful in blocking these androgen receptors. And there's lots of controversy recently about Yaz and Yazmin, which are these birth control pills that have the progesterone is blocks testosterone receptors. And the controversy about this is another class action suit in the United States about increased risk of clotting. We know that the birth control pill has a small risk of DVTs, clotting on the calves, and why is that important? Because some of those clots can spread into the lungs and can be fatal. The risk is incredibly low. There are genetic factors like a Leiden 5 factor that runs in families that show an increased risk of the clotting. We know that individuals who have been on a birth control pill for a number of months and haven't had any problems with clots are very unlikely, if they continue with this drug, to have a clotting problem. The run-of-the-mill non-acne birth control pill is said to have 5 episodes of DVTs, deep vein thrombosis, per 100,000 women years, as opposed to these newer drugs, the Yazmin, the Yaz, 9 per 100,000 women years. So yes, there is an increase, but it's all very manageable, and I think that we find them to be very effective, especially in adult women who have acne. Another thing that I'd like to comment on is that mothers particularly are terrified about Accutane, isotretinoin. Frequently they don't know why they're frightened about it, but there's this aura that this is a bad drug that their child should not even consider using. I think it's a drug that has to be followed closely, has to be used appropriately by people who are experienced in using it, and it's a life-changing medication with very low risks if monitored carefully.